Are you curious about how Capstone Leadership Solutions can help your small healthcare organization to improve and grow with more speed and ease? If so, reach out to us at capstoneleadership.net. There's a contact us page, or you can email us at info@capstoneleadership.net. We're here to help. When we follow this formula, which I'm calling the fading formula, we are depleting, we are stressing, we are causing deterioration of our culture, of our service excellence, and our quality of care because we are not investing enough in people, service, and quality pillars. And at the same time, we're not investing in them, we are stressing them through higher volumes and less resources. That is a formula for fading an eventual failure. It is a slow fade to being good, then fair, then poor. It rarely happens overnight.
Welcome to Culture Change RX, the podcast for healthcare professionals that are committed to creating a thriving workplace culture, improving the experiences of employees and patients, and ultimately unlocking their organization's next level of potential. I'm Sue Tetzlaff, your host and co-founder of Capstone Leadership Solutions. Join me and my insightful guests each week as we share actionable insights for navigating the crucial people side of the business of healthcare. Subscribe now for a weekly dose of Culture Change RX. Now let's dive into this week's conversation where culture change takes center stage.
Thanks for pressing play to listen in on another episode of Culture Change RX. I am Sue Tetzlaff, co-founder of Capstone Leadership Solutions and the host here at Culture Change RX. After 33 glorious years in this industry, in particular, healthcare executive of small and rural healthcare organizations, and a strategist, trainer, and coach to dozens of them now for the last more than 13 years, I want to share an important observation and two formulas for you to consider. So the observation is this, that when we come to leadership, when we take over being a senior executive in a healthcare organization, we do not come to this place wanting to just maintain the status quo. And God forbid, we aren't looking to lead it to decline or closure, right? We are coming to this place, to this position to improve and grow an important community asset. It is what we went to school for. It's what we've studied and learned and practiced. It is why we pursue such a position, is to be in that place to influence the future, the positive future of a healthcare organization, an important community asset. So I've observed this to be true. I don't believe that anyone comes to these positions wanting to cause harm, wanting to just skate and maintain the status quo. However, when organizations find themselves in a place where they are in poor health as an organization, and there's lots of ways we can measure the health of an organization, right? Just like humans, there's a way we can measure the health of humans, different lab results, different assessment findings, just like organizations, different metrics, whether that's financial, whether that's service, whether that's quality, whether that's human resources, people metrics. There are metrics that speak to the health of our organizations. There are assessment findings, right? It's palpable. There's reputation. There's things that we can observe and feel that maybe aren't measurable, but do speak to the well-being of a healthcare organization. And when they are unhealthy, they did that under somebody's watch, right? An executive team, a CEO, a board, a medical staff, a management team. They got there under the watch of a well-intended CEO, a well-intended board and senior leadership team, right? So how is it that these well-intended, working hard, caring a lot people ended up in a place where the organization is unhealthy. Like, what led to that? I was part of that. I became a senior leader in a healthcare organization that was unhealthy. I stayed there for 10 years and I worked hard and I cared a lot. And I was putting everything in place that I knew at the time that I'd learned in my master's degree and in my internships and all the conferences I went to. And my peers on the senior leadership team were doing the same. And our organization at best was saying the same, which was fair to good. And in some places, kind of poor and getting worse day by day. I inherited it at first, and then I contributed to it for almost a decade in my leadership. It felt like we had no control. It felt like no matter how much we cared, how long we worked, how hard we worked, what we tried, nothing was consistently gaining traction to improve and grow this hospital. So we reached a certain point where, gosh darn it, we have to do something or this organization is spiraling to closure. And I remember the day. I remember sitting in our executive team. I remember we were in our strategic planning cycle. We had a great planning cycle and we were at it again. We were in our 3-year strategic planning cycle and getting ready to start it again. And we were looking at the data and we were looking at the trends and we were seeing that we weren't in any better position than we were when we started that plan. I remember saying these words, I am not going to be on the leadership team that loses this important community asset. Some of you know the story that day sent my entire organization, me included, on a mission to figure out what it would take to turn this organization around. It took us 2 to 3 years to study and research and mastermind the plan, and it took us another 2 or 3 years to execute it. And on the other side of that was massive improvement, massive transformation that has permanently changed the trajectory of that community hospital in positive and good ways. And it was born out of that experience that our company, Capstone Leadership Solutions, was found to bring these lessons, to bring these learnings, to bring these solutions to other healthcare organizations. And now it benefits organizations that aren't necessarily in as poor a shape as ours was, not in decline like ours was, but just committed to improving and growing and wanting to do that without so much angst and overwhelm. And what I've really come to learn and believe, and to see it enough to believe that it's true, is that our industry is at risk of decline when we use the wrong formula, which means our plans and our execution approach is focused on the wrong formula. I'm going to assert that there's 2 formulas that can guide the plans and the execution of those plans for healthcare organizations. And it could be a hospital, it could be a large hospital, it could be a small hospital, it could be a clinic, it could be a system of clinics, it could be a nursing home, it could be a system of nursing homes. But any healthcare organization, and maybe any business, but I'm in the business of healthcare and in particular small and rural healthcare organizations, is I'd like to assert that there's 2 predominant formulas that guide the strategies and the execution of those strategies in healthcare organizations. I'm going to call one the fading formula, and I'm going to call the other one the rocket fuel formula. And both of these formulas are guided by what many healthcare executives would be familiar with related to strategic planning, balanced strategic planning, where we create balanced strategic plans in the areas of 5 pillars: people, service, quality, finance, and growth. And if you want to right now, start on the left and put people, and then next to that on the right, service, and next to that on the right, quality, and next to that on the right, put growth, and next to that on the right, and put the pillar finance. So put these 5 headings across the page: people, service, quality, finance, and growth. This is the pillar approach to balanced strategic priorities. Now, where the formula comes in is that the fading formula is actually described in a webinar that I was just on with another organization. And I pulled out a 2-minute clip and I've inserted that link into the podcast notes here, into the show notes. But I'm going to describe it to you right now, what this fading formula entails. And in essence, what it means is this: on that far right, where we've got our finance pillar, and next to that, on the left, the growth pillar, that a lot of strategic priorities in healthcare organizations are focused on taking our financial gains, any money left over from paying for operations, taking our financial gains and investing them in growing the organization, whether that's new service lines or increasing the volumes or the market share or the location of where we provide certain services. And so we're increasing our volumes and our revenues by investing in this growth. And when we do that, so if that's our predominant strategic formula and approach, is to take excess revenues, reinvest that into growing volumes, growing service lines, adding service lines, what we're actually doing is we're stressing our people, service, and quality pillars. And if you add to that, if we are also at the same time, while we're growing our volumes, growing our service lines, we have big strategic priorities to decrease expenses, we yet again are more so stressing our people, service, and quality pillars. That whole adage, doing more with less. When we follow this formula, which I'm calling the fading formula, we are depleting, we are stressing, we are causing deterioration of our culture, of our service excellence, and our quality of care because we are not investing enough in people, service, and quality pillars. And at the same time, we're not investing in them, we are stressing them through higher volumes and less resources. That is a formula for fading an eventual failure. It is a slow fade to being good, then fair, then poor. It rarely happens overnight. It is this continuous application of this fading formula that will lead to the long-term deterioration of an organization, and I would assert even our entire healthcare industry. If we look at the current state of our healthcare industry, and in particular, small and rural healthcare organizations, and especially those that are not performing above average in any of the ways we measure the health of a healthcare organization, likely the cause of that is the execution of our strategic plans based on this fading formula. But what is an alternative to that? That's what my organization was on a thirst to find, right? We were using that fading formula. We had for years used that fading formula because, when you're in financial crisis, the way to get out of it is to increase revenue, decrease expenses, or both. We were living that out year after year for a decade, 2 decades, and more. And it had gotten our healthcare organization to a place of possible spiral to closure. And as the executive team, as the board, it was our job to turn that around. We needed a new formula. We didn't need a new strategic planning cycle. We needed a new formula to guide the outcome of what that plan was. And then we realized we needed some new execution systems too, to be able to execute well on this great new plan that was guided by this formula. So what is this alternative formula? I'm calling it the rocket fuel formula. And I'm calling it that because one of the CEOs that we're working with at a rural hospital in northern Minnesota, the CEO there calls this approach like adding rocket fuel to his organization's future and success. So I'm going to call this the rocket fuel formula. I'm going to borrow his words. So considering this same pillar approach, people, service, quality, finance, and growth. And again, it'll be really good for you to watch that 2-minute video clip. So because you'll be able to see a bit more about the fading formula and the rocket fuel formula in a visual. But let me describe it to you here, starting again at that far right. When we have money left over from day-to-day operations and we can reinvest money back into our organization, we move that to prioritizing the investment into strengthening the pillars of people, service, and quality. That is our core business. That is why we exist. Our mission is all about providing high quality care to our community. And that takes people, service, and quality. And we must invest in that. And when we do, and we elevate people, service, and quality from good to great to even greater, it is like adding rocket fuel to your growth strategies. Because now we can leverage that strength of being a magnet for talent, a magnet for patients. We are more competitive than ever, and our ability to grow comes with more ease and more speed. So yes, we do invest in growth, but the approach to that is investing in people, service, and quality, and then leveraging that for ease and speed of expansion or addition of service lines. And that's what CEOs come to do, right? They come to these positions as senior executives in a healthcare organization to be chief stewards of the future of the organization, its improvement, its growth, and this work to create a better future is detailed in the organization's strategic plan. But if that strategic plan is built on the wrong formula, if that strategic plan is not executed well, at best, we're likely getting short-term gains, blips on the screen, improvements that decline again and aren't sustained, or at worst, the organization is fading into decline and hopefully not failure and closure. If your organization is ready to start prioritizing the people, service, and quality pillars of your organization, and you want to create these strong foundations, right? These are the rock of your organization, the foundations of your organization, the mission of your organization, people, service, and quality. If you're ready to shore up that foundation to create more strength and solidness and greatness in these foundational pillars of your organization and turn that into rocket fuel for more speed and ease and growth, it is likely time for you to reach out, book a call, and have a consultation to talk about the strategic plan and the execution systems of your healthcare organization. Like I mentioned, I believe that this is an industry-wide challenge and problem, and it might be one that's affecting your specific healthcare organization. And if you are a senior leader of that healthcare organization, if you are a board member of that healthcare organization, you are the people to make the decisions about what that plan is and how you're going to execute it. That is your job. And sometimes organizations, sometimes leaders, sometimes trustees do need help with that. If you were building a new building, you would think nothing about going out and asking an expert for advice for architectural design and build support, right? You would not do that yourself. You would go get expert help. There is no shame in getting expert help in crafting a strategic plan based on a formula that works and being guided to adopt and optimize systems for executing any plan well. And that's what we do at Capstone Leadership Solutions. We are that help. We are that support. We do provide that guidance. And these aren't just good ideas that we think are good ideas. These are ideas that are well tested in dozens of healthcare organizations, starting with my organization, where we masterminded this and implemented it and measured the results. And now 14 years later, dozens of healthcare organizations have adopted our framework, our formula, and our 4 systems approach to transforming the future of their healthcare organizations. That's all we do. That's why we exist. And it is such exciting and purposeful and rewarding work. And every organization that says yes to this framework, this formula, and this 4 systems approach is strengthening their healthcare organization. And when we strengthen a healthcare organization, we strengthen a community, because I saw what happened in my own community hospital. When we got stronger, when we got better, I saw what that did to our community. When we added jobs, when we raised the bar as an employer, when we raised the bar as a business, it raised the bar in the whole community. Every employer, every business, people, service, and quality getting better. It is contagious. It works. And it is contagious. I serve as a chief strategist and CEO for Capstone Leadership Solutions, and I personally would love to spend an hour with your executive team to provide a free consultation on your organization's strategic plan and execution systems. And I go into every one of those calls wanting that 1 hour to make the biggest positive impact it can on your organization. You can't solve it all in an hour, but you can start seeing the pathway forward. All you have to do is email me at info@capstoneleadership.net or go to our website, capstoneleadership.net, and you'll see the contact us page where you can self-schedule a call. Put in the note there that you want a planning and execution call with Sue, and we'll work with you to make it happen. So as I close out here today, 2 calls to action. Let's make it 3. 1, take a look at that 2-minute video clip that is in the show notes that explains more about the contrasting formulas. Number 2, consider for your organization which formula is currently in play in your strategic plan. And number 3, if you'd love a consultation on your current plan and execution systems, email me at info@capstoneleadership.net or go to capstoneleadership.net and reach out to me via the contact us page. Join us again next week, every Wednesday, when we bring another episode of Culture Change RX. Bye now.
Thanks for tuning in to Culture Change RX. If you found value in today's episode and you are a believer in fostering change in healthcare, join us in making a difference. Follow, rate, and review our podcast on your favorite platform. Share it with colleagues and your network. Together, we can make a lasting impact. Until next week, keep inspiring positive change.